You apply a cream, the itch stops, the rash fades, and you think you're in the clear. But the moment you stop the treatment, it comes back, often spreading wider and burning hotter than before. Today, we are going to break that cycle. We are building a step-by-step eradication protocol designed to locate the fungus and kill it at its root. To start, you need to take a close look at the affected area on your skin and gather any tubes of ointment or cream you have been using to treat it. Escaping this loop requires a deliberate, multi-phase system. Randomly applying over-the-counter ointments is exactly what keeps the infection alive. Step 1 is the visual diagnostic. The most common point of failure in treating a rash is misdiagnosing standard dry skin or a heat rash as a fungal infection. Look at this illustration. Ringworm has a very specific geometric footprint. It forms a distinct circle marked by a raised, angry red border along the outside edge. Notice the center of the ring. Unlike other rashes, the skin inside that red border usually looks relatively clear and healthy. That outer boundary is also where you will feel the primary symptom, an intense, burning itch localized right on the red edge. If the area you are looking at lacks this clear-centered, circular structure, you are likely dealing with an allergic reaction or a standard heat rash. Confirming this exact geometry is a mandatory requirement. You must know exactly what is on your skin before you introduce any chemical treatments to it. Step 2 requires you to look at those creams you gathered earlier. We need to audit what you are actually putting on your body. If you have non-prescription generic steroid creams like Panderm, Quadraderm, or Betnavate, you need to throw them in the trash right now. Using these medications initiates a biological chain reaction known as the steroid trap. This animation shows how steroids behave on the skin. The substance rapidly flattens the surface-level inflammation, which quickly stops the itch and makes you believe the infection is cured. But look at the layers underneath. The steroids suppress your local immune system. They actually act as a food source for the fungus, causing the roots to multiply and tunnel aggressively into the deeper layers of your dermis. Because the fungus secured itself deep within the tissue, it is guaranteed to return twice as strong the moment you stop applying the cream. By applying unauthorized steroids, you are actively fertilizing the organism. This single mistake is the primary reason patients end up with a rash that feels impossible to cure. Step 3 is environmental control. To survive, fungus requires a continuous, uninterrupted supply of heat and moisture. You have to deprive it of both. This means maintaining absolute dryness. After showering or sweating, you must rigorously towel dry your entire body, paying special attention to skin folds where moisture naturally collects. Next, shift your wardrobe. Switch entirely to loose, 100% cotton garments. Synthetic fabrics trap body heat and sweat against the skin, creating an ideal incubator. You also need an isolation protocol. Keep your personal towels, bed sheets, and daily clothing strictly separated from the rest of your household's laundry. When you wash those items, use the highest heat setting possible. Heavy, dense steam and boiling water are required to break down and kill the dormant fungal spores that get trapped deep inside fabric fibers. Maintaining a sterile, dry external environment physically starves the organism of its life support. You have to establish this baseline before any medical treatment can actually succeed. Step 4 is navigating the medical timeline. You need to visit a licensed dermatologist to obtain genuine, targeted antifungal medication, which usually involves a combination of pills and topical creams. Once you start this medication, you will face a major psychological hurdle known as the relief trap. This calendar illustrates the typical treatment timeline. Around day 5 of a proper regimen, the active symptoms fade, the visible red ring disappears, and the intense itch completely stops. If you stop your medication at this visual cue, you fail the protocol. The fungus is not dead. It has simply retreated into a dormant, sleeping state, represented by this long incubation period on the calendar. You must commit to a strict 3 to 6 week continuous treatment cycle. The medication has to be applied exactly as prescribed, every single day, even when the skin looks completely perfect. During this long timeline, practice strict hand washing immediately after touching the affected area. This ensures you do not accidentally transfer the spores and self-reinfect other parts of your body. Measuring your cure by the duration on the calendar, rather than the disappearance of visible symptoms, is the ultimate requirement for permanent eradication. You now have the 4 pillars of the protocol: verify the ring geometry, purge the steroids, control the environmental moisture, and commit to the 6-week calendar. There is no magic overnight cream. Breaking the infection cycle requires strict daily discipline to give your body the time it needs for skin cells to regenerate and for the inflammatory response to fully subside. Completing this process eliminates a highly contagious spore from your environment. This protects your family members from contracting the infection through shared surfaces or clothing. Conquering this cycle removes the constant distraction of the itch, restoring your long-term peace of mind and your bodily autonomy. If this breakdown helped you understand the mechanics of your infection, share this protocol with anyone else trapped in the same cycle, and make sure to subscribe to the channel for more disciplined, system-based approaches to your health.